So now let's talk about case studies. Here I'm going to talk about the basic principles, again, the advantages and constraints, how you can evaluate the quality of a case study, and how you can use case studies in your own social work practice. So case studies provide rich, in-depth research on single instances. They may use multiple methods, so you may have a case study that looks at an event through interviews, and it looks at documents of an event. Maybe there's some observations, so some ethnography that takes place as well. There might also be some survey data, so some quantitative research that is used in a case study. So case studies can use multiple methods to try to understand a really in-depth to really get an in-depth look at a particular instance, an event, or phenomenon. And one of the advantages of a case study is that it really does provide a really deep understanding of a complex phenomenon. So, maybe some sort of historical example. It could be a case study of a hospital. It could be a case study of even a policy. It could be a case study of a variety of different things. But the point is that it's usually one, or maybe you could have a case study comparison where you have two or three different phenomenons that you're comparing. But the core thing to take away from this is that it's a very in-depth analysis of a particular event or phenomenon, and it's often using multiple methods, although it could just use one particular method, like looking at a bunch of documents about this event or a bunch of interviews, trying to understand an event. So again, there's overlap here with case studies and some of the other methods that we've used or discussed. One of the constraints or limitations of case studies is that, again, it's not generalizable. While it can provide important information and theories, it can help generate hypotheses for why something may happen. It can be instructive about processes, but you can't necessarily look at a particular event and then use that to say all events after that are going to follow the same pattern. Sometimes it's hard to find comparisons if a case study that you're looking at is especially unique, complex, or rare. Again, you don't need necessarily comparisons, but because comparisons can be helpful in generating theory, that can be a limitation of a case study. So if you want to evaluate the quality of a case study, one thing, like other qualitative research overall, is you want to be able to look at an article and see that it's really engaged in some in-depth analysis. It's not just superficial or surface level evaluation or examination of an event or a phenomenon. The other thing that you want to look at is this bounded? Did the researcher set boundaries to this case study? So it may be unrealistic, a case study examination that looks at something much too big is not going to be able to provide the kind of depth that you really want to see in a good case study. So, for example, following our train of hypotheticals or case studies, you might see a good case study would provide potentially an in-depth analysis of cancer health disparities by looking at a particular healthcare facility, and maybe they have interviews with patients and doctors, and they look at policies, hard copy policies, and maybe even informal policies. So maybe there's some observation that takes place that sees what are people actually doing in practice when they engage in conducting cancer treatment or they're interacting with patients. Those are basically those are different ways that you might actually see a case study, a good case study that's in-depth employed. Now, that same case study of that facility could be, again, a needs improvement category if it, for example, only looked at, like it just sort of casually, gathered a few interviews here and maybe looked at one document that didn't really provide much information. And then, you're going to see the researcher is going to be less likely to be able to provide some in-depth theory and explanations in a way that they could if they were doing a much more in-depth analysis. And so you may be able to, when you look at an article, you could ask yourself, what are some other pieces of data that they probably could have gotten that they didn't? And if they don't discuss why they didn't have that data, that's also potentially a red flag. There could be very obvious reasons why they don't have the data, but if it's something that you would expect them to include in a case study, so for example, if it was a case study of this healthcare facility and they wanted to use interviews and they wanted to look at racial disparities, but they only included interviews with white patients, you would kind of wonder, why only white patients, unless you're looking specifically at a case study of how white patients are understanding potential disparities. It seems like a very odd thing to do. So you'd want to really think through what are the limitations here? Why is this this particular case study not engaging in the in-depth analysis in this particular way? So now let's talk about how we could use case studies in our social work practice. Again, we're going to use the same hypothetical, the same case study, and we're going to then reflect upon it afterward. So I'll read it again. You are a medical social worker that specializes in cancer treatment. You work with older adults. While your medical clinic serves patients across several counties, including both rural and urban areas, you have noticed that most of your patients come from one county. This county tends to be more rural. You want to understand what factors may be driving this disparity. So take a moment, reflect on the question, think about how a case study might be particularly useful in helping you understand this disparity. When looking at a case study, you might be able to see that perhaps in this particular, in a particular case study that looks at a health facility, you may be able to see that there are a lot of interesting discussions in like let's say, for example, this case study uses focus groups, interviews, and observation. Now you might be able to see that by combining all of these different methods, and again, case studies don't need to actually combine multiple methods, but if it does, you may see in this example, you may see that the interactions between the patients are surfacing some really interesting insights about how doctors and patients are interacting with people in this rural community that are potentially different than folks that are coming from an urban area, for example. And so maybe there are assumptions being made about people from rural communities that aren't being made about people from urban communities, and people are reflecting upon this in the group dynamic because it's the first time they're really thinking about some of these. Maybe, when you yourself are going to see a doctor, you don't have those comparisons, whereas if you're in a focus group and you're talking to other people, it's easier to make those comparisons. So maybe a case study is going to give you some of that information, but it also, if it's got interviews, it's also going to give you personal reflections about why there might be this disparity. You also, if you're looking at, if the case study has observation, then of course you're going to be able to see what's actually happening at the health clinic that might be driving this disparity between urban and rural areas. You might also, if it's a case study that's looking at, maybe it's a case study that's only looking at documents, and you have just a bevy of documents and data from collecting from who's actually going to this clinic, what are their transportation limitations, what are their economic means, and maybe looking at this data, you can actually see, you can pull out some themes about what is actually surfacing. Now note, in this case study, you could also be using this for quantitative research too. So if you're using it for qualitative research, the researcher is going to be looking for themes about processes and trying to make sense of what's actually happening in this complex situation. In quantitative data, again, the questions are going to be different, but they may be using the same documents for a different purpose to collect numerical data about who's coming and how they're coming, and how many people are coming, and it's going to provide a different type of case study. So case studies can be both quantitative or qualitative. So in this situation, if the researcher is using this case study for a qualitative component, you're going to be able to potentially use that information from that article to help you understand circumstances within this, this of why this disparity might be happening. So realistically, you're not going to be able to find, you probably won't find research that has a case study of your specific clinic, but you may be able to find a case study of another clinic or cancer health disparities in some other capacity, and that might inform your ability to think through interventions or policy change at your particular institution that might help you better serve people that are experiencing cancer. All right, so now that you've had time to reflect on how case studies might be helpful for you, let's think about how could some of the following case studies help you more specifically. So, for example, if you were to find an article, a research article that looked at an in-depth case study of your region's hospital, how might that help you? So it might provide specific information about your location, maybe not cancer specific, maybe not age specific, but it might provide information about your location that could give you insight about what might be driving some of the disparities here. You might find another article that provides an in-depth case study of a particular cancer facility. And so in this situation, this might be instructive to help you understand how disparities in cancer specifically might be surfacing in the facility that you're actually working at. You might also find a different case study that compares rural and urban health treatment in a particular location. Probably won't be your location, but nonetheless, it could help provide rich information about why there might be this disparity generally between rural and urban, why that might surface in that particular location, ways that might actually provide some insight about what might be driving some of the disparities here. And if you have multiple case studies that you can look at, that might actually help you really try to better understand different factors that might be driving these complicated processes of disparities that you're seeing at your particular facility. So when looking at case studies, you might also ask yourself, are there other factors to consider? So for example, race, ethnicity, religion. Is stigma driving the health disparities? Is there disparate resources and transportation? Maybe the rural area someone in a rural area is more likely to have a car. In contrast, someone from a rural area who's an older adult may be less likely to have access to a car. So an in-depth analysis through a case study can really help you unpack what some of those reasons might be, how people are understanding their options in getting to this particular facility.